Hi, good evening.
Hi. Good
Great to see you.
evening.
Thank
Great
you
to see
so much for
you.
joining us, Nikki.
No, thank you for having me. This is such an honor, and I'm excited for our chat
I am
tonight. It's
looking
going to be
forward
great.
forward to it. There is so much going on in the world, but I know this is an extremely important conversation for us to dive into this evening. Hi,
Hi,
hi, Dr. Inglis. How are you? Good to see you.
I'm good. How are you? I have my AirPods in to try and keep down the noise. Let me know if they're too loud.
No worries, no worries. So we have another guest that will be joining us shortly. But in the interest of time, I would love for us to get started and we'll just integrate her into the conversation. So good evening to everyone that has joined in. Um, Thank you for joining us for tonight's Justice Now conversation sponsored by the National Urban League. I'm your host, Jerica Richardson, and I serve as the Senior Vice President for Equitable Justice and Strategic Initiatives at the National Urban League. So, I mean, let me just say this. I know there are so many folks that are ready and waiting to tune in to the President's State of the Union address this evening. And I thought it fitting as we enter Black History Month to talk about some of the issues and challenges that are impacting the Black community. And specifically, I wanted us to focus on the state of Black maternal health in this country. I mean, we've all seen the articles, the data that's out there. It's hard to be in any conversation or read any newspaper where this issue is not one that's lifted up. But I really want to address the question, why are so many Black women and their babies dying in childbirth or shortly thereafter? And so I'm really excited to have the two of you join us, and also an additional guest that will be joining us shortly to really delve into this issue. Um, and so let me just start by just introducing you all and giving our viewers who have tuned in a little bit about your background. We are joined by Dr. Tiffany Inglis. And so Dr. Inglis is medical director at Elevance Health and is an OBGYN who is focused on maternal, child, and women's health uh, needs and clinical programming. Welcome, Dr. Inglis, excuse me.
Thank you for having me. Happy to be here.
um, Thank you. And I also want to introduce Miss Nikki Dawkins. So Miss Dawkins is a holistic reproductive health doula and activist based in Miami, Florida. Nikki, I wish I was in Miami with you right now. It's a little cold up here in New York. Um, but Nikki is the founder of Work It Moms LLC, a mom-driven organization that focuses on providing educational workshops, community events, and a safe space for mompreneurs and working mothers. Nikki, thank you so much for joining us.
Thank you for having me.
Well,
Excited to
let's
be here.
jump right in. I know we started out by saying that there are so many issues with Black maternal health and mortality in this country, but I would love to hear from you both if you could lift up some of those issues and your thoughts on how we should be addressing them in 2023. So Dr. Inglis, I'll start with you, and then Nikki will go to you.
Yeah, I mean, as you pointed out very well, there's so much that we're learning and have known, but are sharing more broadly and really trying to spotlight on about our increasing rates of preterm birth and our increasing rates of maternal mortality and that in the United States of America, women in general don't do as well in that space compared to other countries, but also Black women have a significantly worse incidence of many of those things. And we all as parents know that childbirth process, that experience through that process, and then raising those children, it's so valuable to have that positive experience and to have, a healthy outcome and really coming together to work on the why. I think we've done a few different work groups with lots of different people. And, you know, it's a complicated issue, and we have to figure out why so we can start fixing it, and fixing the fact that Black women are dying at 3 times the rate of white women. And why is that happening? And why can't we just do better overall for all? But really also, in doing better, we have to improve and get rid of that gap at the same time, right? That work has to coincide. It has to walk hand in hand. And so what we've been trying to do is figure out the why, do lots of different reasons, a multifaceted approach to understanding it. So then we can start doing things like we do with Nikki and her amazing organization to help fix some of those problems and to try to drive to new and better outcomes, especially for our Black moms. So, you know, some of the things that we've seen is that by supporting people's social, we call them health related social needs, right? So we know that if you have high blood pressure, or if you have diabetes, or, you know, we know those things are impactful, right? To a time in your life that when you are pregnant, when you'll be bringing your child into the world, but really also understanding that where you get food from, how you get food from, do you have a stable source for food? Do you have social resources? Do you have a net and a community around you that can help support you? And what does that look like, and how can we better support that? That is equally valuable in your outcomes and the positive outcomes that we see associated with pregnancy. And when we see that, one of the biggest factors that help support women in that space are doulas, you know, and really working with Nikki and organizations like Nikki's to help increase access to doulas for all women. This shouldn't just be for certain women or some women. We want to get this for all women, and really improving access to that. And then understanding too that in the Black community, this appears to have a really, really positive impact, and acknowledging that, moving forward with that, and trying to, again, increase access in that space. And then also, you know, looking to how do we improve understanding of biases that we come into as healthcare providers across the spectrum, and how do we do better and understand what those are, so that then when we're providing care for women, we're addressing that within our daily work and we're improving that. So I would say those are some of the biggest areas, and I'll hand off to Nikki because I know she's got lots of good things to say.
Well, thank you for that. And Nikki, I mean, that was a perfect handoff, because I will say I really was not even aware of the term doula until recently in the past few years. So I'd love for you, who is in the space and doing the work, to unpack what that means and talk a little bit more about what you do as it relates to this overall issue.
Sure, definitely. I think from our perspective, being in the community, we feel like we know why. We kind of have a different viewpoint on what's going on because we're experiencing it. And I feel like, especially with the pandemic, it has just brought so many things to light, including this crisis, really been spotlight. And I think now that people are onto that, they want to solve the problem, and a lot of great organizations are working to do that. And I think, to what Dr. Inglis said, is access is really important. We as a community have built this for ourselves because we had to. We didn't have, we filled the gap for ourselves within the community. But what we need now is the right organizations and the right policies, the insurance companies, healthcare workers, to work with us, to support us and embrace us, because we have a lot of great knowledge that can be shared. I always say holistic healthcare and, you know, the more modern healthcare go together so beautifully whenever they work together and collaborate and hear and really understand each other. So I think for us as doulas and as a community, what we're looking for at this point is we know how to do the work. We know what our communities need, but what we need is that support from our government, support with policy, support from healthcare providers, and also, just like Dr. Inglis also said, was the re-education of our healthcare providers today. They need to be re-educated on how to work with the community, to work with holistic providers, not just doulas, acupuncturists, chiropractors. All of that matters. All of those are things that we have used traditionally for years and are now coming to light. And so I think it's important that these organizations recognize all the different ways that we approach maternal health, because we've been doing this from the beginning. We have community support. That mental health issue going on right now, that's something that we used to do. We had those tribes, we had that village. That's broken because of a system that's designed to break us. So we need the system to work with us now and support us better. as doulas.
Thank you so much,
That's my take.
Nikki. And I see we have been joined by our final speaker and guest for this evening, Assemblywoman Ronise Bishat Hermelin. And Assembly Member Hermelin actually represents the great borough of Brooklyn, Brooklyn's 42nd District. We are so excited to have you on, and you arrived just in time. I think Nikki was talking about how we can work within the system, but also what are some of the policy approaches that we should focus on when we're talking about the issue of Black maternal health. So welcome, and thank you so much for joining us.
Thank you so much for having me. It's really a pleasure to be here to talk about such a vital, important issue around maternal care.
And so, Assemblywoman, I'd love to hear a little bit more from you, because I know you have sponsored legislation in this space, but that you also have a personal story and experience with dealing with our medical system in this country and some of really the disparities that impact Black women and other women of color.
Yes, so let me just tell you a little bit about my story. In 2016, I was at risk preterm labor, and I unfortunately had lost my son due to incompetent cervix. What happened was, when I went to the hospital, a very well-known hospital with a high profile, they actually turned me away. They told me that, you know what, we don't want to touch this. We don't, it's an insurance issue. Yes, your baby is coming out, but you know what, go home. And if the baby comes out, then call 911. Well, fortunately, I did not go home because I didn't want to die. And of course, I didn't want my child to die. I went to a safety net hospital nearby where they actually took me in and cared for me. And unfortunately, my water broke, and then I had to have a baby who was found to be stillbirth. He did not live more than past 2 hours. And so I thought about that. I didn't sue. I was very upset, to having to go through this tragic experience. And so I decided to be a voice for many expectant mothers who go through this, the trauma and having to be part of the statistics, and the disparity that has been in our society, in our community for a very long time, where Black women in particular don't have access to equity health care. The bill is named Jonah Bishart Khan, after my late son, which is a bill that mandate hospitals to take care of those who are coming into the hospital at a preterm risk. And these are typically women who are between 20 to 24 weeks. Some hospitals don't know, the definition of viability within the 20 to 24 weeks. And sometimes they just don't want to touch that situation because of malpractice, potential suits and things of that nature. So we did that bill, and it took 4 years to pass, but we finally passed that bill. And so now we know that women who are at preterm risk can't be turned away, and it's their choice. And it also is a bill that would provide information on when you do have a preterm baby, all the risk that comes along with it. But since then, I've been on a path and journey with a number of advocacy groups in understanding and bring awareness to what it is to have access to good health care, how we can bring preventative measures to prevent people from dying while giving birth, and preventing our babies from dying. As you know, Black women are in some states 3, 4, 5 times more at risk of losing their lives giving birth, as opposed to a white woman giving birth. And our children are also at risk, at a much higher rate. So I've been working with doulas, I've been working with midwives, I've been working with a whole bunch of advocacy groups, and we've been promoting different types of bills. We have a number of stillbirth bills, where, women who undergo these tragic experiences can have access to resources. We are pushing for the family paid leave bill, which is a bill that would include those who have lost a child to stillbirth experience. We are asking OBGYNs to do more checks on their cervix, because most of the preterm issues happen from incompetent cervix, and the doctors are only required to check the cervix once. Many of them don't want to touch the issue because, again, insurance, they don't want to pay high insurance rates and things of that nature. So we're doing that, and just recently I introduced a bill called Mickey's Law, which is a bill that gives a person the right, a mother or an expectant mother who have a dead fetus, to give them the right to remove the baby. We had a situation where a mother was not given the right. They told her she needs to wait 2 to 3 weeks. A hospital had turned her away because of their religious belief. They don't believe in removing a dead fetus because they consider it abortion. And it was just a very traumatic experience. So we're now pushing the state education department to mandate that OBGYN residents learn how to do DNCs and DNEs and things of that nature. So that's a bill that we're pushing. And we're also working closely with the mayor's office in terms of rolling out a number of doula programs as well as birthing centers. I'm really excited about that. 2 things that has happened since then. 6 years ago, I have birthed a healthy baby boy, my rainbow child. His name is Daniel Jean-Jacques Hermelin, so very much of a blessing. But during the course of this whole journey, I also have raised and have pushed to build a new healthcare center in my district, because my district in Flatbush there's a high rate of maternal mortality. And we now have a new center called Morris Height Health Center, where the second floor is dedicated to women's health. We have a doula program. We have a WIC program. We have it's just different. It's a program that will provide a comprehensive healthcare package to those who are having a baby. And I can tell you that my experience the second time was very different. I had an MFN, a maternal fetal OBGYN. I had a doula. I had a midwife. I had a network of people who were there to help me. I was at bed rest. I'm old. I'm 50 years old right now, and I did it. And even at that pregnancy, I had to be careful. I was at bed rest, and there was a point where I could have died because I had complications delivering my baby. But again, I had a set of doctors who were familiar with me and was part of my journey. Another cause that can be prevented with maternal mortality is your doctor should know who you are, should be part of your journey. Many times the doctors are not familiar with the risk that many of these women are experiencing. I can tell you that when I was at the other hospital, which is Columbia Hospital, okay, I only met my doctor once, my OBGYN. So that doctor had no connection with me, didn't know any risk factors or anything. Where my second experience which was at a safety net hospital, okay, had doctors who were cultural competent. They spoke my language. They understand people with socioeconomic challenges. They were very caring. They ran every single test on me. I was on watch. I was on medication. They looked at my diabetes level. They checked my cervix plenty of time. They sewed me up. I didn't have sufficient iron. They made sure that I had iron treatment every week. I mean, it was just all these little things that makes a big difference. And yet, and still, my delivery was complicated. And it's because I had competent, caring doctors is why I had a successful delivery and I didn't die. So all of this matters. And the way we push policies is, unfortunately, we go through these experiences. I had a number of mothers who call me, or women who have gone through similar tragedies, and we created bills. We created bills to avoid other women going through the same thing. So again, I think the way we do this and the policies that we're pushing are policies to prevent more deaths, you know, mother and baby.
Thank you, Assemblywoman, and thank you so much for sharing your story, and thank you for your leadership and really just finding yourself not only on the front lines of this problem, but taking your pain and turning it into purpose and action so that you could help so many other women. I feel really good to hear about some of the reforms that are taking place in states like New York. We know that there are challenges in so many other states. And I also recognize, I know that you're joining us, but you also have other things on. So I do appreciate you making the time to tap into this conversation. Dr. Ingles and Nikki, I just wanted to turn to you. I think one of the things that really stood out to me when the Assemblywoman was talking about some of the disconnect and the lack of communication that she had with her provider the first time around and early on. Is there any advice that you would give women who are or others who are on this kind of this birthing journey or thinking about starting a family soon? Is there any advice that you would give them, especially Black women and women of color, if there are things that they should keep in mind, questions they should be asking potential doctors, or outreach that they maybe should do to a doula? I would love to hear from you both.
Sure.
Nikki, you want to go first? You want me? Okay. So I would say, you know, we've done a lot of this, but I think it's just a matter of reminding. And I think it's so important. What you're talking about right now is so important. Giving people the right, I would say, or the power to really feel like you have a voice and you're allowed to have a voice, and you should be able to ask, and you should be able to, if you're not sure, you say, I don't understand, right? And really making sure that power is given. Everything we hear is exactly what you just heard. I didn't feel like anyone was listening to me. I felt disconnected from my care. I didn't feel like I was being valued and understood and a part of that pathway. And you have to be able to feel like you're getting the most out of it, and you have to be an equal partner in it, and you need to be an equal partner in it. And I think in those ways, that's when some of the doula work, what we saw that was just so obvious was that when women who had doulas, you know, there were lower preterm birth rates, there were lower NICU admission rates, there were lower concerns from like a depression and anxiety in the postpartum space. And it's really because overarchingly, they told us, I just felt valued and heard finally. I felt like I had this partner that could support me through the pathway and through the process. And so building that up, and through doulas, but through other pathways too, to try to make sure that everywhere the women turn, or people who are pregnant turn, they have the ability to really feel like they can reach out for that empowerment source, or they can find that empowerment source within themselves. So I'll hand it over to you, Nikki. I know you're passionate on this one because it's really important.
Sure. Sorry, I'm having a little bit of a cough today. But yeah, I think everything that you said also is very important. For me, I always feel like the moment you know that you want to have a baby, or you find out you're having a baby or pregnant, find a doula. And the reason I say that is because the sooner you find a doula who understands what you want your journey to look like, we are a resource. That is one of the biggest things that we do, is we provide resources for you along that pathway. If you're high risk, if you're, wanting to be at a birthing center, if you want to birth at home instead, if you want to be under OB/GYN care as opposed to a midwife, we're here to help guide you along the path and find the right providers for you, because a lot of that is the issue, is people don't know the providers that are available to them. I'm in Florida. We fortunately do have a lot of options. You can birth at home, you can birth at a birthing center, you can birth in the hospital. We do have choices, but so many times I get clients that don't realize they have those options. They're just like, oh, I just need to go to the hospital. And I always ask them, like, do you feel comfortable doing that? Is that what you want to do? And sometimes they'll be like, oh, well, no, I was thinking about a birthing center, but I didn't know. And they don't realize that it's covered by insurance, or, that there's somewhere close that they can go and do that. So finding somebody like a doula is really important from the jump, I think. And there's all sorts of doulas, obviously. There's, I'm full spectrum. So I work with you from menarche to menopause, is what I like to say. You get your period and I'm there. Your period ends and I'm gone. So I feel like if you find somebody who's full circle, holistic, that can work with you from the beginning, that's the best thing to do. Then when it comes to when you do meet that provider, lay out what you want your plan to look like, what you want your pregnancy to look like, what you want your postpartum care to look like. Because another thing that's very forgotten, there's a huge gap in postpartum care, especially with OBs. Midwives, it's not so much. They tend to be a lot more better with the follow-up, and they see their clients every week in most cases here in Florida. But OBs at 6 weeks, you have the 6-week gap after going through this major event on your body. So trying to figure out what all of that is going to look like is really important. And also we like to address, like, what's your lifestyle like? Are you stressed? What's your job look like? What is your aftercare going to look like whenever you go back to work? Do you have to go back to work? Can you work from home? So kind of, I think having a doula from the beginning can help you look at your whole plan holistically from the beginning, so you can find the right steps to get to where you're going. And then also just being a guide for when you do get with your provider, and like Dr. Inglis said, asking those right questions and those hard questions that sometimes we're afraid to ask because we've been taught not to, right? So coming in there and being like, hey, what's your C-section rate? I'm high risk. How many VBACs did you do this year that were successful? Asking those like very specific questions sometimes can feel like a little like you don't want to be rude, or you don't want to come off like a know-it-all, or piss off your doctor, but they're important because it's your birth and nobody gets paid if you don't show up. So it's your world. Ask the questions. I think that's really, really crucial. And then again, don't forget about your postpartum care. I think postpartum gets really overlooked, especially when there is a loss, which I want to say I'm so sorry for your loss and so happy for your rainbow baby. Such a blessing. And I'm sure you can contribute to this, but sometimes whenever we do have a stillborn or a loss, because I work in that area as well, the postpartum period is kind of like forgotten. And we forget that this person still went through a birth and still had a baby, right? We still have to help them heal. We still have to dry up that milk. We have to help them mentally. We have to help them find the support that they need, a community to help them. And we don't like to take that path, but it's important to think about it. Have a support system.
No, and it was helpful, and I appreciate the advice that you shared. I think it's so important that this isn't just a session where we talk about the challenges and the issues, but that we give people opportunities to really explore solutions. And I know the assembly member has another engagement to run to, but I just wanted to turn to you and just see if you had any final thoughts or words that you wanted to share with this group before you have to leave.
First of all, I want to thank you for having me on, and I'm sorry that I have to leave. I am in the middle of an event, but I wanted to thank our speakers for being here and sharing their expertise and their experiences. I'm so happy that I had a doula because it was life-changing, and I didn't know anything about where to start, how to start, what was best for me, what should I ask my doctors, what things I need, was this, how to even do my baby registry. I didn't even know what to pick. And even on the point of postpartum, again, a lot of times, especially Black women, we're carrying so much weight, and we don't think about that we do need to take leave. We do need to check, our blood pressure. We need to, follow up with the doctor. All of that, sometimes we just typically dismiss because we're so quick to continue and pick up from where we left off to, take care of our families or work or whatever. And a lot of times our environment and our society expect that of us. Like they expect us to just pick up where we left off. They do not expect us to take some time for ourselves. And I know last time, 2016, there was a group of advocates who didn't understand why I needed to take maternity leave. And, that was really hurtful because, my life, my health matters too. But that's because society and, just expect that of Black women. Like, okay, we don't, it doesn't matter. Yeah, you just had a kid. Okay, or you just lost a kid. Okay, whatever, keep it moving. So it was very helpful to have a doula. It was helpful to have doctors who were following up with me. These were doctors of color. It was just a different experience. And so I just want to thank all of you for bringing this awareness, for allowing me to speak. I want to thank our doctors, our doulas who are on this call for being caregivers and helping our women and our children live. So with that, again, thank you so much. I look forward to working with you and again to pushing the movement in closing the disparity gap in Black maternal care.
Thank you so much, Assemblywoman. We really appreciate hearing from you this evening.
Thank you. Have a good night. Thank you. Bye-bye.
Thank you. So Dr. Ingles, I just wanted to turn back to you and Nikki. I think one of the things that the Assemblywoman lifted up, and you also talked about it, was really the impact on our mental health. And I think we can't underscore that enough, how much we need to be talking about support, whether pre-pregnancy or post-pregnancy. I would love to hear a little bit more from you and Nikki about that.
I think I'll start with just a little bit of facts. So, between 2017 and 2019, the CDC did a study that showed that up to 80% of maternal deaths were preventable. And over 50% of those deaths occur in the postpartum space. And the top two killers of women or of moms, or however you want to say that in the postpartum space, are mental health related and cardiovascular disease related. So as you think about that, it is such a crucial thing that we have got to support and structure that support around our pregnant people to understand how they need us and what does that look like, and make sure that they're equipped with what they need to be able to know when maybe things aren't going well for them. Because to be honest with you, sometimes postpartum depression doesn't always look like what everyone thinks postpartum depression looks like. And so really understanding all of the ways that it can impact your family, your feelings, your daily functions, and really making sure that what Nikki talks about is, that group that's really supporting the person who just had a baby is understanding that maybe some of this, that's what that is, and really getting that early sign and getting those warning signs caught quickly, and then getting people support and help. Support structures matter. They really, really matter when you're dealing with things like depression and anxiety, which are so common in that postpartum space. And really, parenting is hard. Being a new parent is hard. We talk about all the joys and we talk about the wonderful moments, and there are wonderful moments, and it's such a gift, right? That you get to have this family and this child, but there's a lot of hard moments, and as your body has just gone through this terribly physical thing, and then, your life is changed. It is turned upside down. For any of us who had them, it, right? Your life is just different the minute it happens. And I think it's very, very important that we just keep speaking up about it and telling people what could it look like for you. It might be different for me than it is for Nikki, and that's okay. But understanding what that looks like, and then being able to make sure that people know where they can go to find help, and what that help can look like. And that help might be different for me than it might be for Nikki, and that's okay. It might be something that I need that's different. But getting it is the most important piece, and making sure you have that wraparound support there and that structure there.
Well said. I just want to acknowledge that you were getting a lot of love in the chat, your last comments. And Nikki, I also want to flag for you that one of our viewers that tuned in that said, hospitals should hire more people like you to really help folks navigate the process. So just wanted to share, as you all are talking, some of what I'm seeing. There's a comment about this is such a powerful conversation. Thank you for this. So many thanks to the two of you for joining me. Nikki, did you want to chime in on the mental health piece?
I think Dr. Inglis said it very well. I think creating spaces for the people providing the service to recognize when things are going on is super important. And then also the rest of their birth team, which is usually their partner, their parents, sisters, brothers. They are also, I always say, I'm here for the family. It's not just you, it's a family, right? So I think building them up as well as part of your pregnancy care is important, what their expectations are, and kind of filling the space that sometimes happens when people are having a baby. It's a lot of advice. It's a lot of like, oh, well, we did this with you, so you're fine. And you might have a different route that you want to take. So sometimes having, a doula, a therapist, somebody, a spiritual coach, a tarot reader, whatever you use, right?
Community, right? Surrounding ourselves with supportive
your
folks
community.
during this process.
Yeah, absolutely. And kind of building that out in advance, I think, is really important. And then just also kind of dipping into yourself. I always say, like, let's journal. Let's remember to sip that tea while it's hot. Let's go outside and breathe some air. We get so lost in the baby, and everyone else gets lost in the baby. So sometimes it's hard for us to remember, like, hey, I need to do little things for myself, and they don't have to be long. They just have to be intentional and for you, and not benefit anyone else, right? And also not harm you. I always say, like, not necessarily have a glass of wine or anything. Do something that's also good for you. But I think implementing that into the care plan is very important. And then just kind of being able to recognize that we talk so much about the things with mental health and what your body goes through and all of that, but we tend to avoid the overwhelming love that happens when you become a parent. And that is scary, makes you anxious. It changes the way that you view the world completely. It changes your path. I know that's what happened to me. I became pregnant and I was like, I don't want to do what I'm doing anymore. So I feel like we need to talk about that part more. Like, hey, you're really going to be a baby. Like, it's going to be intense. I hate that we only have one word for love, because I feel like the love you feel for a child is just so incredibly unique and soul changing. But I think just acknowledging that as well and letting everyone know, like, you're not alone with this feeling, and this feeling is important, and it's here to benefit you and make you a better parent and give you a guide as to what you want to do with your life and your child. So yeah, I think, again, looking at everything holistically when it comes to mental health is important.
Yeah, I love that. I mean, we really do have to acknowledge over and over again how much of a blessing it is to be able to give life, and really it's about a family too, and I think that's important, that all the things that we do or don't do impact a whole community of individuals. And it's so important for us to make sure that we emphasize the humanness in all of us when we're having these conversations and talking about these issues, because I think that's when we see some of the challenges where there's a disconnect and we're not really seeing the humanity in another person, or we're just thinking about another person as another number. But everyone has someone that's going to be impacted by this experience, or multitude of people. So I want to keep that in mind. I know our conversation is coming to a close, but I can't wrap this conversation without us talking about the elephant in the room. I know we're headed to the State of the Union, and folks are going to talk about that later, but Roe versus Wade. I know people talk a lot about this issue. It's something, how healthcare for women, especially this type of healthcare, that is something that's been up for debate across this country in different states and places. But I wanted to, turn the question over to you all. What impact, if any, can the state of play for Roe versus Wade in this country, how does it impact maternal health? Or how could it impact maternal health? Dr.
Yeah,
Ingles?
yeah. I can I don't think we know just yet, if I'm being totally transparent. I think it's a little early to know. And I think it's important to keep an eye on and watch, and then where do we go from there? But I don't think we know just yet. I'll pass it back to you, Nikki.
Yeah, I agree. I think that it's so new and we're still figuring out how to navigate this change for many states. And we are still figuring out exactly how it's impacting everyone. I know in my work as a doula, it's definitely a difference um, because of the 15-week ban that we have here in Florida. So it's definitely changed the pace and the urgency of which people want to do it or have to make their decision. And also there's a very long waiting list, which I don't think people realize. And that is a problem when you have a time limit. And it affects your maternal health because if it's something that you need or that you want for yourself, you should be able to do it because we want people to have control over their reproductive health. That is, I think, just very important, and I feel like this topic is going to continue to be a thing in doula work and birth work and maternal health care as we learn more, like Dr. Inglis said, and we start to see the stats that we're able to see now. I feel like it's similar to the data that we have coming out now. Even though we know, for everyone to know, they do have to build statistics, they do have to do research and see that. So I'm curious myself to see in the coming years what that looks like for specific groups, especially more marginalized communities that I feel are having the most impact from it.
Thank you, and I appreciate your transparency and honesty and all of that. I do think that there are going to be access issues, and not just access for those that may be seeking to terminate a pregnancy, but there are a lot of spaces and places where people are provided with health care, expecting mothers and others that may come to those same places, and so it could potentially impact access to folks that may go to a clinic that may need resources just to start this journey of maternal health and becoming a mother. And there may not be the same, I think, breadth of spaces and places for that. So to be continued. I know this is a topic that we will continue to focus on at the National Urban League with our partners and others. But I do thank you all for addressing that question. Before we close, I would love to hear any final comments or thoughts that you'd like to share with our viewers, or if there's any advice, recommendations, or resources, anything on the topic that you want to share before we depart. I really do appreciate you all making the time to connect with folks today and talk about what I believe is a really, really important issue for our community.
I'll just take this last one, and I'll be quick, but I think the part that I find refreshing and exciting in all of this is not that this is happening, right? Because we know that that's not what it is, but it's that I get to meet people like Nikki, or that I get to meet people like you, and really start to have these tough conversations, but these conversations where we all want to be at the table and make positive change and really see people who are having babies have better outcomes, especially our Black moms, and the reduction of those disparity gaps, and having these honest, needed conversations about how does this look like, how do we do it, and how do we work together. I always say this, Nikki's heard me say this a million times, we didn't get here overnight, we're not getting out of it overnight, but we also didn't get here alone. We need to be here together to do the work to get back to where we want to be.
Thank you, Dr. Ingles. Nikki?
No, very well said. I agree. I think to what I said before, it's really just people like Dr. Inglis and people like me and other birth workers and healthcare professionals, medical professionals coming together and finding a middle ground, because at the end of the day, we want to do this work to save lives. We want our moms to be healthy and happy and their babies to be healthy and happy. That is the end goal. And to do that, we have to be able to understand each other. We have to find a common language here. And I think that in the coming years, that's really what we're aiming to do. And having platforms like this is exactly the path. So thank you so much for putting this together and allowing us to be here and talk about this. This was really great conversation.
Both. And let me say, I'm not a mom yet, but I hope to be able to connect with doctors as great as you and doulas as incredible as you. And so I learned so much from this conversation. And I really, really am glad that we were able to share so much information with those who have tuned in. Thank you both for joining us, and thanks to everyone who joined us for tonight's Justice Now conversation. There's so much work that needs to be done, but it starts with being honest, being transparent, and really talking about some of the challenges that we are facing today in hopes of moving forward and finding more space and place for better solutions. Thank you all, and have a wonderful evening.
Bye. Have a great night.
Thank you.
You too.
Good night.